All right, well, why don't we kick this off, and if more folks join, we'll bring them up to speed. Um, so why don't we introduce ourselves first? So I'm David Baker. I'm co-director of the program. I'm also adjunct associate professor in health policy and management at the Bloomberg School of Public Health. And in addition to that, I also work as executive director of population and community health at LifeBridge Health, a four-hospital system here in Central Maryland. And I'll pass it over to Debra and then Christina.
Hello, I'm Debra Thompson. I'm also an associate with the Health and Policy Management program, and I currently teach with the Care Management and Care Models course, which is term 4 in the first year. And my background is I'm a nurse, been in healthcare for 42 years, and oversee care management services for a health system, and very excited to be here today.
Hey everyone, excuse me. Hi everyone, Christina Potter. I am the program manager for the MAS degrees and certificate programs. So I work with our administrative team to keep everything running for faculty and students in the program on the day-to-day with courses and registration and all of that back-end policy stuff. So I sort of run the if you're not sure, reach out to us ship. So so for anyone that ends up joining the program, you'll be interacting with our office in the future. So hopefully we can answer some questions for you today and find out if one of the programs is a good fit for you.
Great. So this is the agenda we'll be covering today during today's session. So starting with an overview of the industry, some program details, moving into the curriculum, a little bit about online learning and what that's like. We'll talk through the faculty and alumni, and then we'll go through admission requirements, financial aid, and take your questions. So moving forward. Okay, and so just quickly, some of the driving forces behind sort of the origin of this program and why it's important. So we know that the U.S. healthcare system has evolved to be a very siloed and fragmented, and is based fundamentally on that acute care model. So focusing really on acute care episodes. We know that there's also demands for accountability in how healthcare is managed. So managing resources from the financial, political, and social aspects, and really need to have a better focus on overall outcomes, not just the results of individual episodes of care. We've seen over the years a shift from volume-based reimbursement and payment to a value-based reimbursement models. So we need to think really beyond the four walls of just the hospital and really sort of think more holistically. And we know that improving health requires a focus on the determinants or drivers of health beyond that individual episode of care. So population health management really focuses on bringing all of that together, bringing together the tools of public health with the practice of healthcare and health delivery. So a little bit about population health management at Hopkins. So it's, again, emerged as an important strategy for healthcare providers and for payers. Johns Hopkins School of Public Health is the #1 school of public health and among the first 2 programs in the country to focus exclusively on population health management, and that started in 2017. And in 2022, the School of Public Health and the Population Health Management Program was among the first 5 to receive the Commission on Accreditation of Healthcare Management Education certification. So the interdisciplinary program that we're talking to you about today provides the benefits of experienced professionals such as Debra, myself, with a comprehensive approach to developing population health management systems, strategies, and tools, and really leading transformation to a more value-based, population-focused model of value-driven, accountable care. The curriculum also examines the importance of drivers and determinants of health, and that includes medical care, public health, genetics, behaviors and lifestyle, and a broad range of social, environmental, and economic factors, which can ultimately impact health and health outcomes. And these graphics are just to demonstrate sort of how public health and population health management kind of work together. A little bit about careers in population health. So the program is really targeted toward experienced professionals, clinicians, managers, who are currently at work transforming hospitals and health systems into value-based, population-focused care delivery organizations. We know there's a high demand for healthcare administration and management jobs with a almost 17% growth rate. And the concepts of population health management really appeal to and could benefit a wide range of healthcare professionals, and really an essential base of knowledge for healthcare executives. So specific examples of positions in today's workforce include Vice President of Population Health, Director of Healthcare Integration, Director of Community Health Operations, and Population Health Initiative Managers. And just a little bit more about the details of our program. So there are two options in applying. There's the one-year graduate certificate in population health management, which is 25 term credits. So that takes about 1 year. And then there's the master's degree, the Master of Applied Science in Population Health Management. So this is 50 credits, 50 term credits. And that's basically divided into 4 terms in each of 2 academic years. So it's a 2-year program, could be up to 4 years, depending on your schedule. And that includes the courses of the certificate program, along with professional development and integrative activity. So the program has really a skills-based practical orientation and is really targeted at people who are working. It's a part-time program and it's 100% online. The pedagogical model is the most kind of up-to-date and recent. So that includes group learning, peer assessment. It's skills-based, focusing on projects, hands-on learning, and practical examples. So you can really kind of take the tools and apply them on your job as you go. And overall, it focuses on understanding and leading population health management systems to improve health within and across populations. And this is just shows you what a certificate program would look like. This is year 1 of the program. So I'm just going to walk through the different classes, the different courses offered to give you a flavor of what the program's like. So everyone, of course, takes the Introduction to Online Learning, teaches you about the software platform that we use. And the first term of the program in the fall has several different courses. So academic and research ethics, then essentials of population health management, and principles and applications of advanced payment models in population health management. The second term has 2 courses. One is collective impact, developing and leading community partnerships to improve population health, and also accountable care, assessing quality and effectiveness of population health initiatives. And that's actually the class I teach. Our third term, the course is our Population and Consumer Health Informatics and Introduction to Epidemiology. And the fourth term of the first year focuses on statistical concepts in public health and managing health across the continuum, contemporary models of disease prevention and care management. And this shows the master's program. So it's that same year one curriculum followed by the year two, which includes the following courses. In term one of year two, applied concepts and foundations of high performance for population health and health behavior, improving health through health education and promotion. Term two is organizing for public health, a systems approach, and behavioral economics and risk, value-based payment methods and incentives. Term three is the built environment, influences and challenges to improving population health, and value-based concept of socially responsible leadership. Finally, in the fourth term of year two for the master's program, there is the integrative activity, which is kind of a capstone project, and social and cultural basis for community and primary health programs. So in terms of online learning, and we have, Hopkins has over 20 plus years of experience in online learning. Courses are developed with high production value, and online course activities are really designed with a goal of keeping students engaged throughout the program. The hybrid model allows for collaboration and student-faculty engagement through Zoom-supported synchronous sessions. So in addition to those asynchronous courses and lectures, we also have in every class, 1, 2, or even 3 sometimes live sessions where you can join your peers and classmates and your professor live in a kind of a moderated program. I talked about the recorded lectures. Again, that gives you flexibility to fit them into your busy schedule. And we have a 24/7 help desk for anything that you can need in terms of logistics or technical issues. So, and I'll just review, this is our multidisciplinary faculty. You can see sort of across the program, and at the bottom of this slide, the different affiliations among our staff. We have faculty who are full-time and faculty that are adjunct and are working in the field of population health management. So, departments include health policy and management, international health, health behavior and society, biostatistics, School of Medicine, epidemiology, environmental health and engineering, mental health, and biochemistry. So I'll pass it over to Christina to go over admission requirements.
Yes, thank you, Dave. So the application for either the degree or certificate program will need to go through the SOFIS system, which is the Schools of Public Health application system. So you either will apply directly through SOFIS for the MAS for the degree program, or SOFIS Express for the certificate program. So we do need you to go through that process in order to get started with a submitted application. All students need to have completed a bachelor's degree from an accredited college or university, and we'll need the transcripts that go along with that, obviously. Students do need to have completed a minimum of 3 years of health-related work experience. As we've said already, the MAS and certificate programs really are geared towards working professionals who are in the health field, who can really bring a little experience, at least a little bit, into the program, and also be able to apply the skills that you're learning in the program. So we do want to see a minimum experience to start. And then we'll need your current resume or CV that indicates your work experience, and any other healthcare accomplishments or goals and skills. The things that are going to be relevant to your work and to the program fit, to let us see that. You'll also need 1 or 3 letters of recommendation. The certificate program, when you apply in Sophos Express for that, it will only require 1 letter of recommendation because it's a little bit of a smaller application process. For the MAS program, for the degree, you are required to submit 3 letters of recommendation. And typically we do want to see, again, this is a program for working professionals, typically for non-traditional, if you will, students that are a little bit older than straight out of undergrad, have some experience. So typically we'll want to see professional references, a supervisor, a project leader, director, an executive from your organization, something like that, that are writing those letters for you. We do sometimes, we'll see sometimes also an academic reference, a prior instructor, if you've had a close relationship with them, if they've maybe served as an advisor, act as a mentor for you also in the field. So that may apply depending on your situation. We'll also need a statement of purpose that is really going to demonstrate for us the fit that you have for the program. Again, both that the career goals that you have, your professional aspirations, where you want to go, really is a good match with the outcomes, with the objectives of the program. We want to see that, again, you're bringing in a little bit of experience that will help you apply and learn from the skills in the program that you'll be gaining, and that you can share with your fellow students as well, to make it a rich and engaging experience for everyone. So we really want to see that it's a good fit both ways. And then for any international students, you do need to demonstrate proficiency in English. And that may mean a requirement of TOEFL or IELTS score. And in some cases, depending on your exact background, if, for example, if you have documentation that all of your education was delivered in English, you may be waived from that requirement. We can go over that with you more in the admissions process. And then for anyone with international education in their background, we do require that everything go through a course-by-course credential evaluation with WES. And that's one of the standard evaluation agencies. And again, that just is the process for any international institutions, anything that you've attended. It can be a little time consuming, a little tedious, but it just helps us to make sure that all of the documentation, all the paperwork is in order for students. So if you do have that consideration, we just ask that you allow plenty of time for that, because sometimes that can take longer than you expect to go through. So that's just the high level of the admissions requirements. Again, certainly if you're getting close to submitting an application, if you want to go over any of that, you're welcome to reach out to our admissions officer, Morgan Fredericks, or just touch base with the MAS office directly. I think we have some emails later on in the slides, and I can always pop them in the chat later too. But that's the overall process.
Great, thanks, Christina. And do you want to cover this too? I think you may have already.
Sure. So for our programs for the MAS and certificate programs, we're actually reviewing applicants as they come in throughout the year. So we have a rolling basis. So certainly we would encourage you to apply as soon as you feel that you've decided that the program is a good fit for you, and when you're ready to gather your application materials. But again, go ahead and as soon as you're ready, go ahead and apply, and we will get a decision back to you as soon as we can. We're not like holding all the applications until everything is in. And in this case, the final application deadline is June 1st for the MAS degree application and July 1st for the certificate application. So again, we'll be reviewing applications well before those dates. So don't think that you might as well wait until just before, because we won't look at them until next summer. That's not the case. And there is, just for your information, if you haven't seen this already in your research, students do enroll in the MAS or certificate programs just one time per year. So it's each fall. So fall 2026, that will be courses starting late August 2026, or maybe first week of September. That's going to be the one start per year. So that's what you're looking at as your next term of application.
And do you want to go through the financial aid piece as well, Christina?
Sure. So, excuse me, for the academic year 2025-2026, the tuition, the part-time tuition rate is $1,429 per credit hour. And that is, that tuition will be billed for part-time students as you register, and you can register for a term, or in the fall, you can register for first term and second term. And there are specific billing deadlines for each term. So, sorry, I think a shadow passed over. But there are specific billing deadlines for each term. So you'll be required to pay them by those deadlines, not a lump sum all at once, but as you register by term. And for this year, the current MAS scholarship is $549 per credit. So that is going to be entered as a credit for you against that $1,429 tuition rate. And when you submit your application for the MAS degree or certificate program, we'll also have the, there's no separate admission application, scholarship application for admission. You don't need to click anything or submit a special form. We're going to look at that overall for you. And then there is also the financial aid office through the school that provides information regarding both federal and private loans, as well as they'll have some links for suggestions of other resources that you can explore for the program, for any of the MAS or certificate programs as well. And we typically, I like to encourage students, remind them to explore basically any personal or professional organizations, affiliations, memberships that you have, whether they're volunteer, fraternal, again, professional related industry organizations, any bit, maybe a military group, if you're a member of, for example, American Legion or VFW, those may have small scholarship amounts, and those will really add up together to contribute towards your degree, towards the tuition costs. So just keep that in mind as you start thinking about, we know it's a large commitment. We're talking about a lot of quite an investment, but just keep in mind all those other opportunities that you may have to seek funding for the program.
Great, thanks, Christina. And so we do have some additional information. If you have specific questions, you can feel free to reach out to our admissions officer, Morgan Fredericks, or just the MAS office. We also have a couple of QR codes here that will take you to each of the applications. So the Master's in Applied Science application and the certificate application. But we also want to open this up for Q&A. So if you have questions about anything about the program, please feel free to ask, and we'll do our best to answer. And I want to add too,
Hi again.
actually, so we're very pleased. Oh, go ahead, Amir.
Not you go ahead. You go ahead.
Oh, okay. I was just going to say we're very pleased to have Debra Thompson with us today, and she is, in addition to being faculty with the program, she's also a former student. She's an alumni of the program, and so she's more than happy to answer any questions from a student's perspective. But go ahead, Amir.
Okay, guys, how are you? First of all, thank you for the beautiful presentation. And secondly, I can see that the programs that you have labeled out is not a good fit for me. And I'll explain to you why. And I also need to get your opinion about what sort of programs that would be a good fit for me. Should I go ahead? Yeah, so basically I've studied med school in Egypt. It's basically 7 years of medical education plus 1 year of clinical training. And then after that, I took the IELTS exam, and also I took an exam called OET as well. And currently I'm in the process of studying for an exam called USMLE, which is the United States Medical Licensing Examination. And I thought to myself, while I'm in the process of studying preparing for that exam, I might as well pursue a master's degree, whether it's in public health or something related to medicine as well. And due to the fact that I'm a fresh graduate, I've graduated in 2024. I've just been employed in this year. So this program is not a good fit for me. Can you suggest something else maybe that would be suitable for me? Thanks.
Sure. And, I'll ask Christina to chime in as well. I know she's worked with folks who have been applying and are sort of in similar situations. So, the Masters of Public Health is another program that I don't think has that working requirement of 3 years that this program does. That could be beneficial. I think it all kind of depends on what you want to do ultimately. Once you go through medical school, or I'm sorry, go through your residency, I suppose. And so depending on what you want to do afterwards, you may just want to wait or apply to one of these programs. But Christine, I don't know if you want to add anything to that.
Yeah, thanks, Dave. Yeah, we can certainly just refer Amir to some of the general school resources for some more exploration there. We do have within the Master of Applied Science suite, we do have 2 other programs, the MAS in Patient Safety and Healthcare Quality. That one similarly does have a professional experience requirement. And we do have a lot of clinicians in there, but again, they do tend to have at least a few years of experience. However, we do also have the MAS and certificate program in spatial analysis for public health. And I'm not sure if that would be necessarily a good fit for you, Amir, again, depending on your interests and what you've done so far. We can certainly send you some information just so you can explore a little bit more. That program does not have a professional work experience requirement. It does ask for students to have some quantitative background, skill or experience, whether it's work or prior coursework, and some strength there, just so you're prepared for the epi and biostats, and working with the ARB program for data analysis within that program. So again, that might be one in particular. Again, that would still be part-time at the rate that works for you, a course or two per term, and also fully online. So again, that formatting may work for you depending on whether the content is a fit for you. So again, I can certainly connect you with Morgan and just send you some of the links for the spatial analysis program, just to see if that's of any interest, and we can go from there. But that would probably be my initial thought. Again, yeah, without, as Dave said, without knowing exactly where you hope to go beyond residency, and what sort of skills you're looking to add into your medical background.
Okay, Christina, how can I reach out to you?
Excuse me. So I will, I have a note, and I can contact you from the MAS office. And I also put in the chat the MAS info for the MAS office.
Oh, well, I see.
Email
I see.
account.
Yeah,
So
okay.
I will, yes, I'll make sure either Morgan and or I both probably will reach out to you soon. She's unfortunately at a conference this week, so she wasn't able to join us today.
That's fine. I would love that.
Okay, terrific.
Thank you, guys.
Thank you, Amir.
While I've got you, could I ask some similar questions related to my background and searching for your a good program fit with you guys?
Sure.
Perfect. So I think I'm generally in the right place or in the right direction with the population health MAS degree. By way of background, I have worked in the US for about the past 15 years, mostly in healthcare, and I've worked primarily with payer contracting or payer strategy and engagement, often on behalf of vendors. So DaVita was one partner I've worked for, as well as startups in a couple different spaces, whether that was mental health care, in-home delivery models, like in-home urgent care, in-home hospitalization, as well as like MSO aggregators. So I've tried to get a good sampling of what there is in terms of private, providers or vendors in the space, always working within as a partner to the payers in the U.S. healthcare system. And I've noticed, kind of over that time, that there's a big gap between what is being used in tools for public policy that ultimately inform a lot of Medicare Advantage and commercial decisions that are being made in those spaces, or how we're thinking about those decisions. And so I'd like to go deeper into public policy, but again, framing it as the integration between public policy and healthcare administration or like healthcare application rather than the epidemiology or like true research route. I think I want to stay in the commercial space. So I do see this as a good fit here in that regard, but I'm curious, based on that background that I provide, are there any other programs that I should look at, number one? And then number two, the one drawback or concern that I've had about this program is that it's fully online, and I have looked at some other programs that are more executive programs that have like a hybrid, maybe 1 or 2 times in person, meeting your peer cohort, which I do think would be really helpful. And those usually have like an executive 10 plus years work experience requirement. So it might be folks maybe a little bit more similar in background and level of experience. So based on all of that, any other programs I should look at that you feel like may be a better fit or a complementary fit to this program that you guys have presented today?
Yeah, no, thanks for that question. It's great. And let me just speak to a couple of different things that you mentioned. So,
Yeah,
uh, first of all, I mean, we do have we've had many students that work for payers or in the payer space to help them manage their population. So,
sure.
certainly in my work, I've worked with DaVita and other organizations dealing with folks with chronic kidney disease to help them sort of better like working together to manage that population of patients, which can be very expensive and need a lot of
Yeah.
care coordination. And I know Deborah can speak to the care coordination aspect too, but that's something that we do and that we provide through this program. I think in terms of your point about connection, we do have many opportunities for our students to connect with one another. So I did mention we do have that sort of live talk feature, which is in every course throughout the program for 2-3 times there'll be this kind of opportunity for a live discussion. So usually an
Okay.
hour where you can chat with your colleagues, and again it's virtual, but it's real time. Also, throughout the program, we do a lot of teamwork. So you'll get paired often with, 2, 3 other folks in your class from various different geographies and backgrounds. And that gives you really an opportunity to work with them. And our course software is designed to make it easy for you to connect. So either through Zoom meetings or we have discussion forums, or you can use Google Chat or whatever you feel works best for you. But there are built and sort of woven throughout the program in the courses opportunities for you to kind of get to know people in the class in addition to your kind of professor. And so maybe leave it there. And I don't know if Deborah or Christina want to add anything to that. Um,
I'll add, Dave. I got excited, Laura, when you started talking about your payer strategy interests and partnership there, because one of the first things that came to my mind was how valuable I think this program would be to
Yeah.
help you along that strategy, along that journey, and also thinking about it from the health system and provider standpoint. What a valuable asset to have someone who has that true population health management experience and training, who could be at the table having those conversations. And to me, the first thing I just thought about was what a great collaboration that could be, that could really take this work to that next level with those that you engage with. So I got excited when I heard about your background. Um, and
I appreciate that. I do think it's missing in my background today is like a true understanding of population health tools. 'Cause there's a lot of decisions that I make that impact those downstream that have to deliver on those programs. And so being better educated on tools, resources, and how we should structure our deals to support that, I think is super, super important.
Oh, I agree with you. I think this program would just be amazing, and I think you would really enjoy it, um, and better prepare you for what you want to do down the road as well. And I'll also add, I know in the course that I teach, we actually have 4 live talks. So every other week we come together as a group, and we'll hear from an expert in the field, but also give us the opportunity to talk among ourselves as well. And then there's also opportunities in each of the courses where you can collaborate not only in the assignments, but also as you hear things that are new that you want to share with your colleagues that are in the program. We encourage you to share and get those conversations going, because you will find peers that you will stay in contact with for years and have that a relationship, and it's a great opportunity.
Yeah, thank you. And Deborah, sorry, for those live portions
Mhm.
of the coursework, what is generally the time of day that those are scheduled to occur?
It's depending upon the course. I'll just tell you for the one that I manage. Typically, we try different days of the week, and it seems that Tuesday is a better time. And so from 6 to 7, every other Tuesday, we come together And for those who can't attend for whatever reason, it's recorded, it's available. Usually within 24 hours, they can access it. You always have opportunity to ask questions. If something comes up later, you're not on the call, or you are and you thought about something, then we have discussion boards and different ways of communicating with the faculty and your colleagues in the program.
Yeah, just to add to that. So in my class, for example, we have just 2 live talks, but one is on a Tuesday, one's on a Wednesday. And usually at that 6 to 7 time frame. Generally throughout the program, we try to make it as accessible to people who are working as possible. So you find it generally in the evenings.
Yeah, David, you read my mind. That's what I was looking for, and that's 6 to 7 Eastern typically that you guys do. I mean, I am a West Coast individual, but that's fine. I work East Coast hours. Okay.
Somewhere later, yeah.
Yeah. Perfect. Thank you. I think those were the couple core questions I had. I really appreciate this information.
Okay. Anything else about the program, what to expect?
No, nothing at this time. This was my first kind of live discussion about the program. So I'm sure I will have additional questions as I go through your application process and things like that. So I really appreciate it.
And Laura, I also add that if questions come up later and you would just want to talk with someone who's been through the program, I'm always available. I've talked with other candidates and students even along the way, those that are already enrolled and we're getting ready to graduate as well. So just know that we're available to assist you and be successful.
Fantastic. I really appreciate that. I appreciate y'all's time quite a bit. I'm going to jump. And hopefully I will talk to you guys soon through the application process.
Thanks for joining us.
Thank you. Bye.
And we'll have this recording of this session posted on our website fairly soon. So if you want to go back and review anything we discussed today, feel free to look at that. And if there's nothing more, I think we can leave it there. And again, feel free to reach out to Morgan or the MAS office, and we'll do our best to answer any questions. So thanks everyone for your time. Really appreciate it. And we'll hope to talk to you soon.
Thank you. Take care.
Bye-bye.